Hello and welcome to this lecture. Today we are going to discuss direct thrombin inhibitors, and among the most commonly drugs that has been used is hirudin or bivalirudin. To memorize the name of the drugs, the common thing is that to look the blue color of the suffix, which is RUDIN. So you can memorize the name of the drugs with the suffix RUDIN. Although in this semester I already mentioned that classification and the example of the drug we will evaluate in your presentations, in your oral presentations. So this is easy now because in the previous semesters students need to memorize the name of the drugs and need to memorize the classification. So that is important. Now you don't need to memorize them, but again they are you are the professionals, you are the healthcare professionals. If for example patient come to you and he has some medication in his hand and he already taking some western medicine, so how can you start the treatment? So the important thing is that you must know the patient, that what he is taking previously, so that you need to understand. As in the last lecture I already discussed that there are many type of interactions. Sometimes western medicine can interact with Chinese herbal medicines or any herbal medicine or alternative treatments. So the interaction with the drugs that has been given before, and then what therapy you are recommending, or if a patient taking both drugs, western and the traditional medicine, you need to know the drug interaction. So the names are important for your professional or your career. So this is another easy topic, it is not a tough topic. The main thing is that they are, as the name indicate, direct thrombin inhibitors. DTI. D stand for direct, T stand for thrombin, I stand for inhibitor, and they exert an anticoagulant effect by directly binding with the active site of thrombin. As if you take a look on the left, the red color sign, so they are directly inhibiting thrombin by binding to its active sites. And if you see on the right sides, you can see that thrombin have something like, you can see that curves, and the drug that bind with the active sites and then they produce the effect. So that's the responsibility of these drugs. Hirudin and bivalirudin is the examples. So they binding directly with the active site and then producing the effect. It could be further classified into parental direct thrombin inhibitors or oral direct thrombin inhibitors. Why we classify in two parts? Because we need to know whether patient require intravenous administration or parental administration, or we can give them oral direct thrombin inhibitors. So for parental direct thrombin inhibitors we have lepirudin and bivalirudin, whereas for oral direct thrombin inhibitors we have dabigatran. So the question arises that, for example, when we talk about hirudin, how we get this medicine. In the previous lectures I already discussed that the natural products are very important. Many drugs can be extracted from natural sources. The simple example is morphine, that can be extracted from opium. So in this case, when we talk about hirudin, the important thing, or we can say that interesting thing is found that do you know leeches for blood-letting or blood-sucking agents? And they have been used since the ages of Hippocrates. They use leech for surgicals, for surgeons, as in medicinal leeches. So actually the drug actually extracted from the leeches. That is very interesting that this drug hirudin is actually extracted from the leeches, because actually the leeches is producing that bioactive compound hirudin. So that is important, that the saliva of the leech. So interesting point is that how they extract the drug. They extract the drug from the leeches, from the saliva of the leeches, and then they develop more recombinations or recombinants like lepidolin. So this is very interesting that the parental direct thrombin inhibitors extracted or isolated from the saliva of the leech, and they then produce different recombinants. And the main thing is that although they have a little effect on the platelets, because it have more effect on the thrombus, as it is direct thrombin inhibitor, so they are more acting on the thrombus. The second thing that is important, that this drug can be administered through parenterally, like heparin, and then we need to monitor the prothrombin time. That is important, and that it is again the same thing that we need to measure the especially we need to measure the thrombocytopenia. If we give them accidentally high concentration or high drug, we need to measure the patient thrombocytopenia. So the drug that is available in the market, lepidolin, is commercial name is Refludan 50 milligram, and then for bivalirudin, it is also available in the form of vial as 250 milligram per vial for intravenous administration. Dabigatran is the oral direct thrombin inhibitors that was approved recently in 2010 to reduce the risk of stroke and systemic embolism with non-valvular arterial fibrillation, having a half-life of 12 to 17 hours. And we mentioned that the drug is a substrate for P-GLYCOPROTEIN efflux pump. So let me explain you this. What is the function of P-GLYCOPROTEIN? P-GLYCOPROTEIN actually is a well-known transmembrane efflux transporter, and that have a number of functions like removal of the drug absorbed in the intestine back to the lumen, or it is used to maintain the integrity of the blood-brain barrier, or it is also responsible for removing the drug from the kidney and the liver into urine and bile respectively. So they have a number of functions. So it is actually, in simple words, that it is a transporter. It is a efflux transporter that sometimes act as removing the drug from the cell as well, or removing the drug that is absorbed in the intestine. So they have a number of functions. And when we talk about dabigatran, actually dabigatran is present in the drug as inactive form, and that inactive form converted into active dabigatran. So that there is a process that the inactive, that when you take a drug, in simple words, when a patient take this drug, the inactive form of the drug converted into active form of dabigatran, and the inactive form, which is also known as prodrug, is actually a substrate for P-glycoprotein. So what is actually going on, that the inactive form of drug is rapidly converted into active form in the liver and in the plasma. So that is why the P-glycoproteins are important before the drug is converted into active form. So it means that the inactive form of the drug can form the complex with P-glycoprotein, and when the drug is converted into active form, then the role of P-glycoprotein is not present. So we need to understand that in simple words, the most important thing is that P-glycoprotein has function for removal of drug, as it is a efflux pump. It is a pump, like you can understand what is a pump. Pump has different roles, like for example in common homes we have pump to push the water out or push the water inside to your home. Every home in our countries, we have, because of the water shortage, we have the water pumps that pump the water from deep inside to the land to our homes. Same like in this case, that P-glycoprotein is the efflux pump that is responsible for removal of the drug from the cell. as it is a efflux. So usually what is actually going on, in simple words, that the inactive form of the drug is responsible to bind with the P-glycoprotein, and what actually going on, that the inactive form of the drug is converted into active form, and then the active form will produce the effect. And the active form is the transformation of the drug from inactive to active form takes very quickly. So usually the role of P-glycoprotein on inactive form of diabicterone is not observable much, as the inactive form is rapidly converted into active form with the help of plasma and liver esterase, which is the enzyme. So I'm not going to go for again biochemistry, as you are not familiar with the biochemistry, but that's the mechanism. But they have a drug-drug interaction, especially with ketoconazole, amiodarone, quinidine, clopidogrel. Why? Because of it increase the effect of diabicterone. So these drugs can increase the effect of this drug. Why this occurs? Because of this P-glycoprotein. What actually happening with some drug interaction like ketoconazole, that if the ketoconazole and diabicterone has been given at the same time, they increase the concentration of diabicterone. Why? Because the ketoconazole is P-glycoprotein inhibitors. So when they inhibit P-glycoprotein, then there will be more availability of the inactive diabicterone to convert it into active form. So what will happen, that it will increase the concentration of the diabicterone because of the availability of inactive form to active form in the liver enzymes. So that is important, and so that is why patient that having the renal impairment, we must need to be very careful and we must avoid the drug, because if there is an interaction with ketoconazole with diabicterone, then it will increase the concentration and it will cause impairment, especially in the drug clearance. So the toxic effect includes the bleeding older than 75 years of age, and there is no antidote available if the drug overtoxicity occurs. So that is important, especially in patient with renal impairment. The drug that is available in the market is Pradaxa, 110 milligram. I have read very interesting article, especially on hydrogen and the emergency use of recombinant hydrogen in cardiopulmonary bypass, and we found that the most anticoagulant used for cardiopulmonary bypass is heparin. But now the alternative of the heparin is available, as now heparin is using as an alternative to heparin, especially if someone is allergic to heparin, because the source of heparin is animal. So if someone is allergic to heparin, then patient can give the other drug, which is on hydrogen. And actually we also need to understand that patient that we also recommend this drug to those patients that have maybe more chances to become thrombocytopenia, especially immune mediated heparin associated thrombocytopenia. So in this case as well, that we have an alternative like heparin that can be given. So you can read the abstract. They mention this, that the alternative form, especially for cardiopulmonary bypass, if patient having issues with heparin due to allergy, due to sensitivity, due to immune mediated heparin associated thrombocytopenia, we can give this drug. So you can read this article in detail. It is quite interesting article that I share with you. So thank you so much for today's lecture. Hope to see you again.